In three, two. Hey, Travis, so talk to us. Tell me one or a couple insurance bullet points, tactics, or strategies that you know can definitely help other practice owners out if we were to implement it today.
Okay, Mike. We were just talking about you had some people who are asking, their fee for service, they're not doing well. Should they go in network? And of course, the way to answer that is to go back and figure out what insurance is there to begin with. Why is it there? Why do we deal with it? And really, insurance participation is purely just a marketing game.
Mhm.
It's knowing that there are people who will only go in network and there's people who won't. So if you're going to stay fee for service, insurance is something you don't really participate with, but it means you're probably going to have to spend a lot of money up front with marketing efforts in order to get that smaller percentage of the population to actually come see you. And so for a fee for service office that's not doing well, my biggest question for them is, how much are you spending in marketing? And is that marketing you are spending on effective? Because if you don't have that skill to market, then yeah, a network may be the option for you. But if you have that skill to market, sure, stay out of network, absolutely. Just realize you've got to pay that money up front. Now, if somebody is deciding to go in network or they are in network, the biggest thing to think about is what you're going to get out of that or what you're doing it for. So being a network is purely about knowing that you're going to spend money on marketing on the back end, meaning when you do work, you're going to take a lower fee for that. And that lower fee is a marketing expense. And that's the way people need to see insurance write-offs. They're purely marketing expenses.
Mhm.
They're not anything else. So, and the reason that's important is you can evaluate what's your marketing expense, what's your insurance participation expense, and is it a continued effort that's worth it? And if you can build your practice and get really busy and have a lot of patients and have a waiting list and be booked out 2 or 3 months, then yeah, you need to start dropping insurances and start raising your fees and things like that. But if you're struggling, insurance can be one of a few tactics to bring in to help. But,
Mhm.
Regardless if you're fee for service, out of network or in network, the thing about insurance is you've got to understand how to manage it. And that's what I talk about all the time is most dentists, they're having challenges. It's almost always from a lack of understanding, a lack of what insurance is there for, a lack of how to communicate with insurance in the first place. So, that's the thing to talk about is what is it that the insurance company's looking for? And if you know that, 9 times out of 10, you'll get paid instantly. And even if you're out of network or fee for service, you need to still understand that same concept because your patients want to get that reimbursement, even if you're not the one waiting for it. Because, can you imagine your office, Michael, if, you had a patient that you told them that insurance is going to pay $1,000 and they came back and paid nothing? Would you have a happy patient?
Super upset. I'd be upset too. Yeah.
Yeah, I'd be upset as a doctor. I'd be upset as a patient.
Yeah.
So, but the number one thing that about communicating with insurance is most of us don't communicate nearly enough. It's like a 2-year-old talking to an adult. That's the level of education that's out there. So, as an example, I talk to insurance reviewers all the time. I've got a few of them that are friends because they're willing to tell me that they work for an insurance company because they know I'm not going to yell at them. And you can get some really interesting insights when you talk to these people that they're reviewing claims all day. And the biggest one out there is they're reviewing claims from dentists that are either very incompetent on what they're billing or completely fraudulent. My best example that I've ever seen from them is a dentist that filed a claim for a surgical extraction.
Mhm.
And there was like 10% of bone left on the tooth. And the viewer is sitting here going, there's no way you had to cut bone or section this tooth to get it out. You could have probably just blown on it and it would have fallen out of the mouth. And yet you still filed it as an incorrect code. And so that's what they're used to all the time is they're
Mhm.
used to dentists who are filing things with no supporting documentation. And so, for instance, if you're filing a crown, the number one thing that gets denied is we often send, or I've seen way too many times, people that send pre-op information. The worst case example is a fractured tooth. You've got a large amalgam, you've got a bunch of fractures, the patient's got pain on biting. But if you look at the pre-op photo and pre-op x-ray, there's nothing that really shows is wrong from the insurance company's point of view. The x-ray doesn't show any damage. The x-ray doesn't show the fractures, just shows a large amalgam that on the x-ray looks fine. On the photo, yeah, you see some cracks, but are they cracks? Are they crazed lines? The insurance company doesn't know. And so they're going to send back not enough information to process this claim, and you're not going to get paid. Now, the thing about not enough information to process is you've just got to realize you've got to send them the information they want to see. So if we've got these fractured teeth, we're going to take out the old amalgam. We're going to clean up any decay. We're going to see how far those fractures go. That's the point that we need to take a photo. That's the point we need to take an x-ray, because that's the point at which the insurance company can actually see, oh my gosh, this tooth absolutely needs work. And if we send them that information, then you get paid instantly. No questions asked, no nothing. And that's the biggest thing, is it's purely communication. If we communicate well, we get reimbursement. Makes life easy.
Yeah. So there's no such thing then, or is there, as too much information when sending insurance, or when sending these things to insurance?
That's a great question. So in that same scenario, when you're talking about pre-op information and mid-op information, usually the pre-op information is too much.
Gotcha.
And the reason this comes in is, again, talking to these reviewers, the number one thing you'll hear from them is they don't have enough time to really look through and diagnose a claim. They're either paid as a salary and they have a quota of how many claims they have to process per hour or per day, or they're paid per claim they process. Well, either way, what that means is they've got a minute or less to look at your claim, get all the data, and make a decision. If you send them, massive long narratives and tons of x-rays and photos, they're going to go, no, I'm going to look at the first thing I can see. Is it enough for me to make a determination or not? In most cases, it's probably not, if you're having to send that much stuff. And they're just going to send back denied or request for more information, and they're going to move on to the next claim. They don't have the time to process it. And so if you send just the very basic detail important points, that's going to work out better for you. So don't send pre-op information, because you're going to confuse them, because they're going to look at two photos like, well, which one's pre-op, which one's post-op, and often they also don't get these things as full-blown shots like we see them. They'll get them as these little tiny pixels, little tiny thumbnail pictures, basically. That's all they get. And so we see this nice enhanced x-ray on our screen, and we're like, it's obvious, but that's not the reviewer usually gets. They usually get a small thumbnail version of it. Wow. And so that's the thing to think about is, yes, you can over talk about what you're sending to, and you can send the wrong information. So you only want to send information that's quick, easy to read, and not contradictory to paying the claim. And that pre-op information would usually be contradictory to paying for, say, a crown, for instance.
Yeah. So they don't even get the full blown picture. They don't even, so they could be denying something. So then give me, like, I guess if you can give us like the outline of what is quick and great where we can get this approved, like, boom, immediately. You know what I mean? Because I was always thinking, like, and this makes so much sense why, like, when I was front office, I would get denied. You know what I mean? Because I'm like, we got to put it as much details as possible. And then they're like, send us more. And I'm like, we don't have any more. What do they want? So then what would be like the best, like, outline for this then?
Depends on the service. That you just got to think about what's the basic information that's absolutely necessary. So again, we'll go back to the crown because it's an easy example. Is you want to send mid-op photos and mid-op x-rays, especially if the damage wasn't shown before you started. If the damage is shown before you start, sure, pre-op works. But mid-op photos and mid-op x-rays are typically the best, especially in fracture cases or old restoration cases. And if you're going to do a buildup, you need to send a photo or an x-ray of after the buildup's done, partially to prove that it was done, but partially also to prove to the insurance company it was a true buildup and not just like filling in an undercut. which is not a buildup
Okay.
and not a covered service. And then when you send a narrative, it should be short. It should be detailed to only the points that matter. So, for instance, how much two structure is missing, or do you have minimal amounts of ferrule that you need to do a buildup, or where's the decay, or what's the problem? Don't send this long, basically full clinical note, because again, they don't have time to read through it. So, like for us in my office, what we always do is we have a checklist form that every time that I do a crown is usually sitting in the room, and I just check it off. It's, here's a check for here's where the decay is, here's a check for here's where the fractures are, here's a check for how much tooth structure is missing. It's just a checklist.
Mhm.
And therefore, when a reviewer sees it, it's a full sheet of paper, but all they have to do is go to the checks and go, okay, this, and this are what's important. Bam, it's quick, it's easy, simple for me to fill out because I don't have to write anything, and my front desk doesn't have to guess or write their own little narratives or remarks. It just makes life easy for everyone, and so
Yeah.
everyone wins.
So you created this checklist yourself?
Yeah.
And that's great, because like you created it, you send it to the insurance, and then they just review it. And then they're like, oh yeah, he kind of did our job for us. He checked off all the
Yep.
boxes, and then
Yep.
bada bing, bada boom. Where can people find this checklist, or is everything like tailored to its own thing?
The checklist is in my new book.
Really?
Yeah, I share everything I can because it's so easy, and it's made our lives so much better with crowns. It used to be before, like my team had to come up with a narrative, so they'd look in the clinical notes, they'd look on the photos, they'd come up with their own stuff because I don't have time to write it all. And this checklist, they don't have to do anything, they just attach it with the claim. And so my front desk job to send out that claim is super simple. We do the same thing for a lot of things, but like I said, crowns are the easiest example that's out there.
Yeah. Has there ever been a case or a scenario where it just didn't work out? Like you were bumping heads with insurances and it was the worst?
For a crown, rarely. And really, the only times it ever happens is if we forgot to take a photo or X-ray mid-op. That's the majority of the times it ever happens.
Mm-hmm.
And that was early in the stage when we started doing it. We just hadn't gotten the habit of it. So, for instance, we have cash patients too that have no insurance. And we used to say, oh, for our cash patients, we don't need to do this extra work because, no insurance company is asking for the stuff. Well, on one end, the extra photos actually help the patient, because if they ever come back and go, oh, my tooth's sensitive, we're like, okay, well, let's pull up a picture of what crap was in your tooth.
Mm-hmm.
But at the same time, it was that habit thing. And so if we were always questioning whether we needed it or didn't need it, then sometimes it wouldn't get done. Versus now, we say we don't care, if insurance is involved or if it's a pure cash patient, doesn't matter. Clinically, it doesn't change how we process things. Every crown, we get the same pictures, the same photos, the same X-rays, and therefore it's simple. No one has to think about it. But more importantly, it just always gets done. It's a habit, and it's a habit we stick with.
Yeah, I like that. You're building the habit no matter what. That way it minimizes like the decision making, you know what I mean?
Yep.
Of everything else. So then do you ever plan, Travis, to like completely, I feel like you're on the good side with insurance, you know what I mean? I don't feel like you're ever gonna be like, I'm gonna drop all of you guys, and then you know what I mean?
It's funny when you say good, that makes me think of evil too. Is there a bad side? And I don't see either one as a bad thing.
Yeah.
I've got friends that are fee for service. I've got friends that are out of network. I've got friends that are in network. All of them can be successful if you treat them right and you know what it is you're getting into. But for instance, I guess your actual question is, am I ever going to drop insurances?
Mm-hmm.
And my answer is what we did last year. Last year, 2 years ago, I was in network with 5 insurance companies. As of last year, we're in network with like 25 insurance companies or more. I don't even know, because of the networks that were in there. I'm pretty much in network with almost everybody again. I went back in network with all the insurance companies that we had been dropping over the years. And it's because we renegotiated. We got higher fees that were not as bad. And we realized that, the fixed cost of the office were the biggest problem. And so the more work we do, the more those fixed costs don't matter and the more profit comes to the office. We're busier, we're happier. And if nothing else, now we have even more of an ability to drop the patients that just drive us nuts.
Mhm.
Years ago, it used to hurt me every time I had to say no to a patient because I'm like, oh, it's just one chair that's not going to be empty. Now it's if the patient even, gives my team a hard time or, is a big problem or just doesn't want to accept treatment. I'm like, all right, fine. I got 1,000 other patients waiting right behind you. If you don't want to show up to your appointments, you can go be somebody else's problem. Or if you don't want my treatment plans, okay, not a big deal. I'm not here to, push you one way or another. And the crazy thing about it is once you get that attitude that it doesn't matter, patients actually feel it and they almost drive themselves to want to see you more.
Mhm.
It's the crazy part is I no longer care what treatment plan the patient picks, and therefore they're more pushy of themselves to get the ideal that we had talked about. Um, so yeah, I actually enjoy being back in network more. We have less demanding patients because we got rid of them all, the ones that were the problems.
Yeah, that's true. That's different. Like you took on, you know what I mean, a lot more. But it is true. Like you don't have to have so much heavy dependence on a specific cash patient who drives everybody crazy, right? And then so forth. So does that mean like you guys also pulled down the lever on marketing as well?
Yeah, a little bit. I mean, what we've done is I've pretty much stopped marketing for general patients.
Mhm.
Now we really just market for specialty services, the things that I really enjoy doing. I started placing implants just a few months ago. It's been so much fun. The nice part is insurance almost isn't involved ever in it because it's like 20% of plans ever pay for implants. So that alone can get you out of network too, is just start doing services that aren't covered. I mean, that's one easy way to get out of network. But I mean, I'm in network and all these services still aren't under insurance fees. So it doesn't
Mhm.
matter to me. Um, and it brings a lot of fun, but it also brings the income to the office too.
Yeah, that's
Find
good,
that
man.
niche.
Yeah, that's really, really good. Well, Travis, I appreciate your time. And if anyone has further questions, you can definitely find them on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
Right now, it's practicewhisper.com. And, I've got a bunch of stuff on there. But we are actually relaunching that website here in February to have a ton more information. So that's the fun stuff to come.
That's going to be exciting. And he has his book. Talk about that really quick.
So that was a labor of love. When everybody else was closed for COVID, I just kept going to the office and I ended up writing. So we wrote this textbook that's basically a team training guide on insurance. It's called Understanding Dental Insurance, a guide for dentists and their teams. And it's 350 pages of just huge amounts of, just neat material on how to understand the process. What are the common failures and what do you need to do about them? And it's got case examples. It's got all the sheets that you were asking about, like the narrative checklists. It's got waivers for how to, charge more to in-network patients. It's got pretty much everything I can think of that you would want, just as a piece of information that doesn't change. So that book, though, as I was telling you earlier, I had to actually spend most of my morning today editing it because it's sold out almost, and they're needing me to do a reprint of it. And so they were wanting me to do typo edits on it. So it's been fun. It's been a lot of fun.
Yeah, that's awesome, man. Well, Travis, thank you so much for being with me on this Monday morning marketing episode.
My pleasure, Michael.